Hi, good morning. I am Dr. Mir Jawad Zar Khan. Today, we are doing a arthroscopy in a young patient who has suffered a ligament injury, and we are today going to do arthroscopic surgery on this patient. So, this is our advanced equipment by Stryker company. Like this, we have two advanced equipments in Germanten for doing arthroscopy. So, in our laminar OT, we are doing this procedure in a very minimally invasive way. So we do a marking here, and now we are going to introduce the arthroscope, which is a very thin camera, which I am now going to show you. As you can see, this is a very small portal. This is a 4 arthroscope we are inserted here, and with this, there's no cutting, no incision, and we are able to visualize the complete knee joint there. You can see this is the ACL. Okay, as I'm showing, this is called as PCL. This is the ACL ligament, and this is the PCL ligament here. And as you can see, this is the cartilage injury. So we are able to see very clearly. This is a smooth covering called as cartilage, which covers the end of the femur. This bone is called as femur, and this young patient has injured his cartilage here. So we are having procedures in Germanten where we can put a patch called as chondrofiller, nowadays available, a German based cartilage paste is available to fill this kind of damages. So this should not progress. If they progress, they are going to land up with arthritis. So this is called as meniscus, where I am showing. This is a very important structure we are seeing in the screen. So this acts as a shock observer between the two bones called femur and tibia and prevents this cartilage damage. This is the cartilage, and you can see live in a patient like I am showing. This is structure is a like a ring, two rings over the femur tibia bone, and this protect the femur cartilage from getting damaged. So this here the meniscus is intact. So this is a important structure which is a natural shock absorber. So this patient luckily does not have any tears. So if it is tear, we repair this meniscus.